I'm here at Manatee Memorial Hospital with Dr. Jeffrey Rossi, an interventional cardiologist here at Manatee. Thanks for joining us, doctor.
Thank you. Thanks for having me.
Let's talk about the program on the whole for just a second here. Describe to us what your interventional cardiology program options are, if you will, for treatments here at Manatee are.
Yeah, so basically what interventional cardiology means, it's a special field of interventional cardiology that focuses on procedures, but the procedures are always done in a minimally invasive way through catheters. So this is what a catheter is. So a small tube like this is inserted into one of the blood vessels, and then we use these tubes to enter the blood vessels and sometimes enter the heart to treat patients in a minimally invasive way.
And minimally invasive to me would be key as a
Right.
patient, because that means I'm not in for lots of recovery, but yet I can still get some advancement and help from your devices?
Exactly. So the size of this would be the size of the incision you would have, and at the end that would be the only thing you would see on the body, the patient's skin or body. So we're able to go into the heart and treat multiple things just through a very small incision. So we use a combination of equipment. So we would put a wire, and this is what a wire would look like. We'd put that through the catheter, and then we deliver all this stuff here we have to treat the heart. So the first things we used to do were stents. So this is what a stent looks like. So a stent is basically a metal cage that's mounted on a balloon, and we would put this in blocked arteries, open them up, and fix heart attacks. And people have known about stents for a long time. We've been doing those for over 20 years. But the field has really advanced, and we're doing more complex things. We're fixing heart valves, we're fixing atrial fibrillation, we're preventing people from being on blood thinners, and that's kind of the things that I think we wanted to talk about here today.
Yeah, specifically, I want to talk about TAVR.
Sure.
TAVR is short for what?
So that stands for transcatheter aortic valve replacement, and as we said, so it's through a catheter, transcatheter aortic valve replacement. So it used to be that if there's a problem with one of your valves, the aortic valve, and I can show you here, so this is a model of the heart. The aortic valve is this valve here. That's the main valve that pumps blood out of the body and provides oxygen to the rest of your tissue. So over time, as people get older, you develop calcium on that valve, and that valve gets blocked up. So it used to be the only way to treat that would be to do an open heart surgery, sternotomy, and replace that valve with a tissue valve or a mechanical valve. But now we can go through with catheters, and we can actually replace the valve just through the groin. So we'd have a system. This is the TAVR delivery system. So you'd have something like this. It would come through.
And this is fairly new technology, correct?
Yeah, this we've been doing this is probably one of the older structural things we do, but you put this would go through the heart, through your blood vessels, it would come through here, and this is a TAVR valve here, and we would actually, over a balloon like this, we would blow up this valve into that position there. It would push the old valve out of the way, and then you'd have a new functioning valve immediately.
And you are actually here at Manatee, number 2 in Florida for these procedures. So I think everybody can really know that this is a very, not to say normal, but common procedure for people with this issue here.
Right, I'd say we're doing hundreds of them per year.
Okay, well that can make patients feel better.
Right, and usually, honestly, people are usually home the next day. I've sent people home the same day. I think the other day I did some of them, I think I sent 2 patients home the same day of the procedure.
Well, that's wonderful.
So it took about an hour, they were in recovery for 4 hours, and then home the same day. So
Manatee is number 1 in what's called MitraClip, I understand, in the state of Florida for procedures. What's a MitraClip?
So MitraClip is the same thing, so it's a different valve. So if you look here, this is called the mitral valve. So what happens in the mitral valve, instead of it getting blocked up, is it starts to leak. So when you have a leaking valve, again, the old way to fix it used to be either by replacing the valve or going in surgically and stitching open the valve. But we have a new technique where, again, through catheters, and this is what the mitral valve looks like. You can see they're all long tubes because they all go through the blood vessels. So this comes into the heart this way, and the clip goes through the valve, and it actually is a little clip that opens up and clips that valve together where the spot is leaking. So in that way, we can fix the leaking again without having to open up the patient, without having to do any open surgery. And that's the same thing. It takes about 1 to 2 hours, and usually the patient is home the next day.
So I'm hearing that we don't need to travel to Miami, Tampa, the Cleveland Clinic to have these procedures accomplished. These are things that you're able to do all right here?
Yeah, I mean, that's something we do on the order of hundreds per year as well. So I think it's just the population in this area is just looking for minimally invasive options, things that can help them get back to their life quickly. So we've just developed an expertise in these types of procedures, and just as you get more comfortable, you tend to do more and more. So we're very skilled at these procedures.
Again, wonderful to have these great hospitals right here on the Sun Coast. For more information about the cardiology program, you can go to manateememorial.com. Coming up, we're going to go back out to the beach where we are patrolling with Sarasota County on horseback.